Thank you for joining us for today's Practice Advantage Pearl. Today I'd like to tackle, with all the healthcare reform and all the changes that are going on in small practices, medium-sized practices, and large practices, there's an opportunity to think about, can we make a better case for ourselves if we manage the practice better? Maybe you've gone through organizational changes. Maybe there's been a merger with another group. Maybe you've grown the practice incrementally over time to the spot where it's not what it used to be. There's been a big change in the number of FTEs that you're managing, the number of patients that you're seeing, and also it might be related to the person that has been given the charge with making everything work smoothly has not had the opportunity, because it's so busy, to have an opportunity to get the training they need to go to the new level. I'm going to playfully dub that Manage-itis. Manage-itis, acute manage-itis, chronic manage-itis is really trying to figure out, do I have some management opportunities and ways that I can improve the practice? One of the signs and symptoms of that is when you ask for a report, do you get a nice, succinct report with graphic trends, or are you getting, which is fairly common, a raw data dump? You've got pages and pages and pages on an Excel spreadsheet of data that you need to sort through to find out what you really want. Or are there changing expectations coming from above for people because the roles aren't well defined within the organization? There's really not somebody that can keep the focus. So the expectations change every day. The second piece here that I think is important is it's around problems with billing or problems with scheduling with patients where it directly affects the patient. Perhaps the patient comes at a time and they're double scheduled inadvertently, not intentionally, and you end up with excessive wait times. Or on the other side of things, it's a billing problem, a billing problem, a billing problem, and that's not coming to you from the billing department. It's coming to you from the patients. It's coming to you from the referring physicians. So looking at that, another sign might be high turnover rate. Do you have a high turnover rate? For most specialty practices, having a turnover rate of greater than 20% is another sign or a symptom of some things that might be going on with your acute meningitis. All these lead to an opportunity for change. So I'd like you to take a minute, think about what kinds of things might be going on from a management standpoint in your practice, and we'll talk next time a little bit about some of the things we can do to diagnose and treat meningitis. Thank you for your time today, and I wish you well.